When people from Ohio recently voted to legalize abortion, they joined a growing number of states where people feel that it is important to protect this type of medical freedom. Now, Florida and other states will have the opportunity to do this next year. Okay. Now, as we look at this very charged and personal topic, might there be a solution that the majority of people would actually support? Let's talk about it. Hey everybody, it's Dr. David. As somebody who, as you know, and the reason for this channel is to support health, education, and choices. And today we're going to be talking about health choices. Okay. Now, of course, when people talk about the ability, about what's being pro-choice, right, which is what medical freedom is about, it doesn't mean that a person is necessarily pro-abortion. Okay, that means that they are supporting people have a right to choose how they live their lives and what medical decisions may be best for them and their families. Okay, I know lots of people who believe that this right should be protected, but they themselves would not perform, would not do it, perform an abortion for themselves or advocate for it in a family member to doing it. But they want to be able to support people who do feel that this is the way to go. Okay, now of course, part of that is also that people have the autonomy that governments and other organizations shouldn't have a right to say what is right for you and your family. Right? Should the government be in our bedrooms? Should our government be in our medical offices? And I think most people would feel the answer to that is no. Okay. Now, I'm wanting to talk more about some of the way that this is being discussed now, because it actually has even changed in the wake of the overturning of Roe v. Wade, and even with the ways that some politicians are approaching this. Now, of course, there will be people, especially those on the religious right, who will always take the belief that life begins in conception and that all forms of abortion are therefore should be illegal. And hey, that's their opinion. Okay. But at the same time, I do want to point out only 13% of people in America, according to a recent Gallup poll, said that abortion should be illegal in all circumstances. That means 87% of Americans are in favor, at least somewhat, of abortion at some point during a pregnancy. Okay. Now, 61% of Americans also say that overturning Roe v. Wade was a bad thing. Okay. Strong majority of people feel that way. Okay. Now, in Ohio, which I alluded to before, this most recent voting that took place that made it a constitutional amendment to protect a woman's right to choose. The ballot initiative won by 12%, which is a landslide in politics. Okay, there were more than 500,000 people who voted in favor of preserving a woman's reproductive rights, compared to not 500,000 people in a state in an off-term election, right, where usually numbers are down. Okay. One could possibly think that it may have been higher if it was during a presidential election where the electorates are often more younger people that vote, but not during the off years. Now, as you may know, also Virginians rejected the anti-choice legislators that they had the opportunity to vote for in the House and Senate, and of course we saw what happened there, where things did actually the House flipped over there. Actually, the Senate flipped, the House stayed the same. But since Roe v. Wade, I also do want to point out that 7 different states have voted to protect it, and these were not necessarily all liberal states. Kentucky, Montana, Missouri chose to do this. I'm sorry, Michigan, not Missouri. Sorry, people of Missouri. Now, also 14 states have completely banned abortion, and 10 with absolutely no exceptions for rape or incest. Okay, now there are other states who have set the limit at 6 weeks. Now, if you're not pregnant during the first 2 weeks because you count it, the pregnancy starts at your last menstrual period. So that means you don't even conceive for 2 weeks, which means that a 6-week ban basically means within a month it's illegal. Of course, that means that some women may not have recognized that they missed a week because that's all it would be of their period. There are, of course, other people who may not have regular periods and may not realize that they were pregnant for a couple months before they realized, oh, this is happening. Okay, so and if they're irregulars, etc. But also, there are 12 states that are now looking to put this on the ballot for next year. Okay, now there is an organization called Floridians that are protecting freedom, and they have about 500,000 signatures out of the 900,000 needed to put it as a constitutional amendment ballot on the ballot for November of 2024. Okay, now one of the things that is discussed in these legislatures, so not legislatures, in these ballot initiatives, is the definition of viability. They're saying that it would be allowed up until viability, which means when a baby would be able to survive outside the womb. Now, that could also mean with very significant medical care, because of the a typical feeling within the medical world is viability is around 23 to 24 weeks. Although I have seen myself around 23 weeks, 22 weeks. The most premature baby ever born that survived was 21 weeks and 1 day. Okay. Um, and so, there are people who are then saying, well, how about a compromise solution, which is being proposed by some people in the Republican Party now, of 15 weeks with exceptions. So again, that's another thing relative to all of this. A ban is a ban, but rape, incest, health of mother, health of baby, etc., are also things that people take into consideration when making these decisions. Okay, now what I would question, though, is that and there is this push within the Republican Party for 15 weeks. And so what I would question is that if you're okay with 15 weeks, which is past when a heartbeat can be determined, why would a person not be okay with 20 weeks? Or for that matter, why would they not be okay for viability? Okay, because I understand some people may say, hey, once a baby can survive outside the womb, then that changes things. And I get that. In fact, there's a large percentage of people who do feel that that's when abortion should not be allowed. Okay. But I can tell you a couple other things about this, why I think the later that this is allowed to, or up until viability. I have seen, this is back in my medical days, but I have seen where teens either didn't know that they were pregnant, or were afraid to tell their parents about it. I actually saw a girl come in at 33 weeks. Her mother, she never, either she claims that she never knew she was pregnant. Her mother didn't realize she was pregnant, although her mom just thought, hey, she had just put some significant weight on. But then she came in and had a preterm baby. Now, perhaps under other circumstances with proper education, maybe that wouldn't have had on, maybe because she didn't have prenatal care because of that. Okay, and maybe with proper prenatal care, they would have maybe caught something, or that she would have, if she would have been eating healthy and doing the proper things, maybe she wouldn't have gone into preterm labor for that matter, or maybe they could have stopped the preterm labor. Okay, so of course, most people, the overwhelming number of people, feel that no matter what is happening with abortion restrictions, if there's any, that of course the exceptions should be put in place. And most people, strong majority, feel that rape and incest, of course, would be reasons for exemptions. But there are other reasons, okay, such as the health of the mother. Okay, what if there was a preterm starting of separation of the placenta, and it was known that that let's say at 18 weeks before viability, that this is separating, and that it could just happen spontaneously, and then the woman could hemorrhage out. That could be a reason why they would need a medical abortion in order to do that in a controlled way. They would lose that baby anyways, but the life of the mother is certainly more at risk in that spontaneous situation. Okay, of course, they can go with the bad hemorrhage. There could be ectopic pregnancies. There could be people who don't realize, or who don't know, maybe they have late prenatal care, or maybe they missed it, where the fetus is developing, where the zygote implants is in the fallopian tube, not in the uterine wall. That there's no chance that would grow into a baby, and it can be very life threatening if they can rupture. You can rupture a fallopian tube, and of course you can't get the nutrient there because you're not going to be able to grow a full umbilical cord, etc., placenta, because there's not room there. Okay, there could be situations where delivery itself could be life threatening. Okay, in fact, we kind of know that's a thing. We know it's more of a thing in underserved minority populations, but there could be certain situations where if it's allowed to go all the way through, I'm not talking about performing an abortion at 39 weeks in order for delivery, but there may be something that's identified at 25 weeks or 26 weeks that would make it the possibility that it would be life threatening delivery for the mom. Okay, or maybe because of the baby's condition, that it could have a significant effect on the baby on that. What if a baby had a it would have, what if, for instance, it was a concern about the effects it would have on a baby. Okay, let's say mom had chemotherapy and it would be toxic to that baby. What if or some of the new anti-inflammatory or immunoglobulin types of therapies that are being used for monoclonal antibodies, etc., that are being used for autoimmune diseases and hyperinflammatory conditions? That could also be a significant problem where the health of the mother would also significantly impact the developing fetus. Okay. Now, of course, there could be also issues with the health of the baby itself. Okay. Now, there could be that it's non-viable, that a fetus is non-viable. Okay. Or it could have a very poor quality of life, and the doctors say your baby probably won't survive a couple weeks, a couple months. Unlikely it would make it through a year, and your baby will probably be in the hospital all the time. Significant cardiac congenital issues. Okay. Or babies who are born with without a brain, anencephaly, or partial brain, that there's no way on earth that baby, just maybe a brain stem that's enough there to keep them alive for breathing and for and they can handle nutrition because their vagus nerve is there, but they may not have any function whatsoever because they never have a developing brain. It may either that it didn't form properly, just kind of unfortunate, more of a blob. It didn't go into the details, etc. So that could be a very similar thing. Certain trisomies. Now, yes, we do know that trisomy 21, Down syndrome, very good chance of success, of survival, very good chance of a very meaningful life. But there are other trisomies, trisomy 18, trisomy 13. Often they don't last through pregnancy, through delivery, but almost all of them are going to pass away within the first few weeks, few months. Again, unlikely to make it past a year with very, very serious medical issues. And if a family says, "Hey, I can't go through that. We have other children to deal with. I am all for having a baby, but not one that's going to die on us." That's sad, and that's a reality for some people, right? My patient who I talked about, who had Potter syndrome, who never developed kidneys because of the fact that they couldn't and they couldn't have a amniotic fluid didn't develop, so their lungs would never develop, etc. And we know that baby passed away within a few hours because she wasn't allowed to have an abortion. Okay, so what's my take on all of this thing? First and foremost, mutual respect. If you want somebody to respect your decision, your opinion on something, your medical decision making, then it should be likewise. We should all be respectful of each other's personal decisions, right? We would want people to respect our decisions. Okay. Now, I realize that the people who are most strongest against abortion are often people who make that decision based upon their religious beliefs. Okay. But that's not a stand on all, and I realize that if you believe that life begins at birth, that life begins at conception, I understand why people would have very significant problems. But you know what? Not all religions believe that way. Not all people are religious. In Judaism also, we believe that life begins at the first breath, not at conception, not at viability, not a heartbeat, but the life actually begins with the first breath of life. Okay. And so shouldn't people be allowed to have autonomy? And my feeling is, first and foremost, if you don't want to have an abortion, don't have one. Absolutely, I would support your decision for that. Okay. But in terms of what kind of compromise solutions, it does seem to me, especially if there are people who are comfortable saying that they're okay at the 15-week point or the 20-week point, then really shouldn't it be at viability, right? I mean, if that's what your decision making is, but still, shouldn't it really be in the hands of the mother, the family, and their healthcare provider to make those decisions? 99% of abortions in America take place at 20 weeks or less. So we're talking about a very small percentage of people who would actually do it at that point anyways. And usually there's because of the health types of issues that will be coming up, right? So anyways, let me know what you think about this. Do you think that there's a particular week or viability or something where maybe there should be something that is proposed that everybody would go by? I realize that this is not there's not going to be a solution that 100% of people are going to agree with this, but if 60 to 70% of the population or more feels one way, shouldn't we be allowed to have those people have their feelings met and have the law support them? Let me know what you think. Have a great day. Bye.